You guys might have to accept.
Hello, everybody. My name is Sylvia, and here I have my partners, Claire, Ashley, and Nicole. And we decided to focus on interventions for burnout. And our topic for today is a review of different interventions affecting burnout in newly licensed registered nurses during transition to practice. Our PICO basically just talking about the fact that the first 6 months of nurses transitioning from nursing school into practice experience the most burnout. And part of the reason is because they don't have like the proper environment or management, as well as not having the skills needed um, to succeed. And we did realize that when nurses are not found in the proper environment, it does affect the quality of healthcare because they are burnt out, as well as the cost, because the longer you stay in the hospital, because the quality of health is not good, that means that you do have more money that's potentially going into your stay. So we just wanted to explore more about this topic and see if there are certain things, certain interventions that can be incorporated into the during the transitioning of students from new grads to just starting practicing nursing. So I will switch over to my other colleagues to talk about the next part of the project.
To find articles relating to our topic, we used the Baylor University library database, and by using our keywords such as new nurse burnout, newly licensed nursing, burnout, and relevant words like that, we were able to populate articles written by professionals in the field. And to further narrow our search, we set filters. We wanted to find a relevant or current research studies that would provide more accurate or relevant data. So we set our date parameters to within the past 10 years, with the last 5 being preferred. And we also filtered the articles to show only peer-reviewed journals, which means that the articles were reviewed vigorously by other professionals in the field and found that their data is supported by the research. And that is how we found our articles for this section.
Thank you, Ashley. This is Claire, and I'm going to just chat a little bit about our article synthesis and how we were able to kind of group the articles, all 6 of them, into 2 main different groups. The first grouping was more involved in like the environment. And when we think of environment, we think of like the place where the new nurse is transitioning to practice. So whether that's the hospital or doctor's office or whatever, it's factors in her environment that will potentially increase burnout or conversely increase job satisfaction and ease of transition. So in the first 3 articles, one by Gillespie talked about how the negativity and bullying in workplace through coworkers and leaders, as well as a lack of knowledge of knowing how to deal with it, negatively impacted the newly licensed nurse transition to practice. And that was a recent one. Many people think, bullying doesn't really happen anymore, but this was in 2024. And the next article under this environmental kind of subheading was from Keeger and colleagues. And that one talked about how when you have positive and inclusive working environments where your nursing leaders, and not only just your nursing leaders, but also like the managers and the directors of even the hospital, When those people are positive and they, encourage and mentor the nurses, it has been shown to drastically improve newly licensed nurse job satisfaction as well as their retention, which of course increases patient outcomes, which saves the hospital money. And then the third article under this environmental subheading was one that was performed actually in China, and this was in 2021. And it talked about how the viewpoint of coworkers or collaborative team members, in other fields, the way that they looked at the nurses, if the nurses felt that they were looked down upon, that would negatively impact their burnout levels, make them worse, as well as if they felt like they weren't receiving a compensation that was equal to the job they felt they were doing. So those two things are more of kind of the environmental things that came through with that research study. So moving on to the next three articles that we synthesized, they had more to do with intentional programming that the nurse residency programs or that the hospitals or institutions that they implemented. So the three that we took a look at, one was by McNulty and colleagues. They found that they implemented a mindfulness training into their existing residency program. And the cool thing is that they were able to show decrease in burnout from the nurses who participated in this mindfulness training compared to the control group who did not participate in the training. And that decreased burnout was sustained through month 1, month 3, and month 6 post intervention. The next article was from Sampson and colleagues, and that one introduced a COPE program into their newly licensed nurse training. The COPE program taught the nurses how to cope by using cognitive behavioral therapy, and it taught them about how to empower themselves. And this training decreased depressive symptoms as well as anxiety and stress, while it also improved their healthy lifestyle behaviors. And the third article under this intentional intervention directly aimed at nurses was a psychodrama therapy intervention. And this one was performed by Ozbes and his colleagues in 2016. And psychodrama therapy it's a little bit more of a creative type therapy where it helps the nurses to similar to mindfulness, kind of zoom out and look at the whole picture, but also then it provided different ways of engaging through different perspectives. So the nurses were able to develop this empathy that they didn't have before, which increased job empowerment and job satisfaction as well as retention. So, so to tell you what I just told you, what we found is that not only does the environment have an impact on the nurse transition to practice, with negativity increasing burnout, positivity decreasing burnout, as well as lack of compensation and lack of respect decreasing burnout. And the other side of the coin being intentional interventions, with interventions that we studied were through these studies, mindfulness training, cognitive behavioral training, and psychodrama therapy training all decreased burnout and increased job satisfaction and nurse empowerment.
So now to go to the discussion portion of our teaching. So to go over some of the synthesized findings that Claire just discussed in the articles that we found, utilizing those findings from those various studies on those interventions for NLRN burnout during TTP, the team identified the importance of creating supportive work environments to reduce burnout and enhance job satisfaction among NLRNs. This include, implementing some policies that address workplace bullying and promoting positive relationships, and decreasing that negativity within the workplace and between NLRNs and their mentors. By fostering that safe and encouraging environment, NLRNs are more likely to engage in proactive population health efforts such as community health screenings and preventative care initiatives. Additionally, the research also highlighted the need to expand on mentorship programs to include training focused on addressing population health issues. Experienced nurses can guide NLRNs in understanding social determinants of health and developing strategies to mitigate health disparities within the communities they serve, ultimately improving overall community health. Finally, the team emphasized the integration of wellness programs such as mindfulness and cognitive behavioral training into the nurse residency programs. And we saw how those can efficiently and successfully decrease some burnout and just help with mental health and positivity and everything in the workplace in general. And these interventions, like I said, have been shown to reduce burnout, enhance mental resilience, leading to better patient care outcomes, which is the goal. By ensuring that NLRNs are well supported and equipped to manage stress, these programs contribute to a more stable and effective nursing workforce, which is essential for advancing population health as well. Essentially, these changes combined are expected to promote better patient care outcomes by addressing the root causes of burnout and enhancing the ability of NLRNs to contribute to population health initiatives.
So after researching and reading and analyzing all 6 articles, we found that there was significant evidence to support that these interventions, the cognitive behavioral and supportive work environment interventions did have a positive outcome or influence on decreasing the nurse burnouts reported. The burnout among nursing staff is an ongoing issue, and it's a global issue, as the article we used sampled nurses in China, and they as well were reporting burnout. So to further our research in this field and on this topic, it would be recommended to continue using stronger research methods and that yield higher quality evidence, and also that the interventions that have been found to be significant on reducing the nurse burnout should be studied and implemented in the nursing practice as a whole versus only in nursing residency programs, which can be very competitive and not every nurse is as fortunate to get into. But if it's implemented practice-wide, then we'll have the better outcomes overall and have a better future.
Okay, this is the end of our presentation, but below are the references. So we had 6 articles, and all but one of them was written by a nurse. And that one is the second to last, the OSBAS, and that was just written by university, so not necessarily like a nurse article. So and we did use the Bayless search engine for all of them, as Ashley spoke about earlier. Thank you.